Have you noticed subtle yet concerning changes in a loved one over the past year? Many assume that death in old age happens suddenly, but the truth is that the body often gives early warnings, sometimes months or even a year in advance. The problem is that these signs are easy to overlook because they seem minor at first. It's only in hindsight that families realize the warning signs were there all along, but by then, it's too late to prepare or make those last moments truly count. In this video, we'll discuss 5 important signs that can appear up to a year before an elderly person passes away. Some may be changes you've already observed, but dismissed as normal aging, while others may seem insignificant, yet indicate the body's slow decline. Identifying these signs early gives you a chance to provide better care, create meaningful memories, and most importantly, ensure your loved one's final months are filled with comfort, dignity, and peace. Stay with us until the end, as these 5 signs can help you prepare both emotionally and practically for what's ahead. When you recognize what's happening, you won't be caught off guard. You'll be able to make the most of the time you have left. Now let's begin. Number 1. Unintentional weight loss, a key warning sign. One of the earliest and most noticeable signs that a person may be nearing the final year of their life is unintentional weight loss. At first, it may seem like a minor change, a belt that suddenly needs tightening, clothes fitting more loosely, or a once healthy appetite beginning to fade. Many families overlook these signs, assuming they are simply part of the aging process. However, losing weight without trying is often an indication that the body is no longer functioning as it once did. When the body struggles to absorb nutrients, muscle mass declines, and essential systems start slowing down. While some muscle loss is expected with age, rapid and unexplained weight loss suggests a deeper issue. It may mean the digestive system isn't properly breaking down food, or the body is losing its ability to process protein efficiently, leading to muscle deterioration. This weakening of the body doesn't just make daily movement harder, it also increases the risk of falls, weakens the immune system, and makes a person more vulnerable to infections. A major factor contributing to weight loss in the final stages of life is a change in appetite. Many elderly individuals experience a reduced desire to eat, not simply out of preference, but due to physiological changes. Their sense of taste diminishes, food no longer holds the same appeal, and meals become smaller or skipped altogether. This isn't a matter of just being picky. The body, sensing that it is shutting down, stops sending strong hunger signals to the brain. As a result, the person consumes less food, leading to reduced energy, loss of strength, and an overall decline in health. Underlying medical conditions can also play a significant role in weight loss. Chronic illnesses such as cancer, heart failure, or kidney disease often contribute to gradual but unnoticed physical decline long before more obvious symptoms appear. Additionally, mental health conditions like depression or cognitive decline can lead to reduced eating, creating a dangerous cycle where the body is not getting enough nourishment to sustain itself. Families often try to counteract this by encouraging their loved ones to eat more, offering favorite meals, or supplementing their diet with protein drinks. While these efforts can be helpful, persistent weight loss, despite increased food intake, signals that the issue goes beyond diet. It is the body's way of preparing for a deeper transition. At this stage, forcing large meals may not be beneficial. Instead, focusing on comfort, providing easy-to-eat foods, and ensuring adequate hydration can help maintain a loved one's quality of life. If you notice significant weight loss in an elderly family member, especially if they seem weaker, eat less, or struggle to remain active, it's essential to take it seriously. This is not just about physical appearance, but rather the body signaling that changes are occurring. Recognizing and understanding these signs can help families prepare with clarity, compassion, and the ability to make the remaining time as meaningful and comfortable as possible. Number 2, extreme fatigue and weakness, a warning sign. One of the most striking changes in the year leading up to the end of life is a deep and persistent exhaustion that doesn't improve with rest. This isn't just the usual tiredness that comes after a long day. It's a profound, all-encompassing fatigue that makes even the simplest tasks feel overwhelming. Getting out of bed can become a struggle, Walking across a room may require significant effort, and once routine activities like getting dressed, preparing a meal, or even carrying on a conversation may feel exhausting. This level of fatigue isn't just a normal part of aging. It's an indication that the body's beginning to conserve its limited energy as it slows down. As organ function declines, the body starts prioritizing only the most essential functions. The heart doesn't pump as efficiently, blood circulation weakens, and muscles receive less oxygen, leading to overall weakness and instability. This is why many elderly individuals in their final months feel unsteady on their feet and unable to maintain the same level of activity they once did. Their physical decline isn't just about lack of movement, it's a fundamental shift in how their body is operating. Another major contributor to this fatigue is a metabolic slowdown. The body, which is designed to generate and use energy efficiently, starts shifting its focus toward preservation. Instead of fueling movement and activity, energy is redirected toward vital functions, leading to increased sleepiness and longer periods of rest. Many individuals nearing the end of life find themselves needing more naps throughout the day, struggling to stay awake for long periods, and experiencing sudden drops in energy. One moment they may seem fine, but the next they are completely drained, unable to continue even the simplest activities. Beyond the physical effects, extreme fatigue also takes an emotional toll. Seniors who once took great pride in their independence often feel frustrated, embarrassed, or even hopeless when they can no longer do what they once could. This frustration can cause them to withdraw from social interactions, stop participating in hobbies, and avoid conversations. Not because they don't care, but because they simply don't have the energy. Unfortunately, this can lead to a cycle of isolation where they stop engaging with others altogether, which only accelerates their decline. The loneliness and sadness that come with this withdrawal can be just as challenging as the physical exhaustion itself. For families, watching a loved one go from being active and engaged to fatigued and withdrawn can be heartbreaking. It's easy to assume they just need to push themselves harder or that they're giving up. But the truth is, forcing activity won't help. What's most important during this time is to understand their limits, offer them the rest they need, and focus on making their remaining days as comfortable as possible. If you notice a loved one experiencing extreme fatigue that doesn't improve with rest, recognize it as a significant sign that their body is undergoing a major transition. This is the time to cherish meaningful conversations, provide moments of peace, and offer support without expectations. What truly matters in the end is not how much they can do, but that they feel loved, understood, and at ease. Number 3, increased cognitive confusion and withdrawal. As a person nears the final stage of life, noticeable changes often occur in their thinking, communication, and interactions with others. Someone who was once mentally sharp and socially engaged may start to forget things more frequently, struggle to keep up with conversations, or become disoriented in places that were once familiar. They might repeat themselves, forget names, or lose track of time, even if they never had memory issues before. These cognitive shifts can begin months or even a full year before passing, and are not just ordinary forgetfulness. The brain, like any other organ, relies on a consistent supply of oxygen and nutrients to function properly. As circulation weakens and oxygen flow decreases, cognitive abilities decline. A person may become easily confused, struggle with decision-making, or even fail to recognize people and places they have known for years. In some cases, they may have moments of clarity followed by sudden bouts of disorientation, almost as if their mind is slipping in and out of focus. Another common sign of decline is emotional withdrawal. As the end of life approaches, many individuals lose interest in social interactions. They may speak less, engage in fewer conversations, or spend long periods sitting in silence. This isn't because they no longer care about their loved ones, but rather because their brain is no longer processing emotions and engagement in the same way. Socializing can become mentally exhausting, loud environments may feel overwhelming, and, over time, many seniors begin to retreat into their own world. Behavioral and mood changes are also common. Some individuals become more irritable, anxious, or frustrated, while others appear unusually calm, detached, or indifferent to things that once mattered to them. This isn't simply a personality shift. It's often the brain's way of adjusting to the body's gradual decline. As cognitive function slows, emotions become harder to express, and reactions to situations change. A person who was once lively and talkative may suddenly become quiet and withdrawn, not because they choose to, but because their mind and body are going through a transition. For family members, witnessing a loved one become confused or emotionally distant can be one of the most heartbreaking experiences. It may feel like they are slipping away before they are physically gone. However, it is crucial to remember that these changes are not within their control. Instead of trying to force them into conversations or correct their memory lapses, the best approach is to meet them where they are. Speak to them gently, offer reassurance, and create a sense of comfort and familiarity. Even if they don't always respond, they can still feel your presence and the love surrounding them. If you notice a loved one becoming more forgetful, confused, or disengaged, don't overlook it. These are often early indicators that the mind and body are preparing for the final transition. This is a time to practice patience, cherish the quiet moments, and ensure they feel safe and at peace. Even when words fade, the warmth of love and care remains. Number 4, frequent infections and slow healing. As the body begins to decline, one of the most noticeable physical changes is a weakened immune system. Someone who rarely fell ill in the past may suddenly seem to catch every cold, flu, or minor infection that comes their way. What used to be mild illnesses may now take significantly longer to recover from, and even small wounds, like cuts or bruises, heal much more slowly. These changes are not random. They indicate that the body is no longer able to defend itself or repair damage as efficiently as before. One of the biggest concerns during this stage is recurrent infections. Pneumonia, urinary tract infections, UTIs, skin infections, and oral infections become increasingly common as immune function declines. Many families view these illnesses as isolated events, but when they occur frequently or take a long time to resolve, it often signals that the body is struggling to fight back. Even antibiotics, which once worked quickly, may seem less effective. Infections that were once minor may now require stronger medications, extended recovery times, or multiple rounds of treatment. This happens because as circulation slows and organ function weakens, the body's ability to respond to treatment becomes less effective. Another commonly overlooked issue is chronic wounds. If small sores, scratches, or bruises take an unusually long time to heal or reopen frequently, it could be a sign of poor circulation. Reduced blood flow means that oxygen and nutrients aren't reaching the skin and tissues as efficiently, significantly slowing the healing process. Those who are less mobile are at an even greater risk for pressure sores, which, if not properly managed, can lead to serious infections. A particularly concerning aspect of infections in the final year of life is that they don't always present in expected ways. Instead of a high fever, an elderly person may simply appear more fatigued, confused, or uninterested in eating. In fact, a sudden decline in mental alertness is often one of the earliest signs of an infection, sometimes appearing even before physical symptoms develop. This is why recognizing these changes early can make a significant difference in the level of comfort and care they receive. For families, watching a loved one battle repeated infections can be both frustrating and heartbreaking. It is natural to want to pursue aggressive treatments, hoping that another round of antibiotics or another hospital stay will bring improvement. However, there comes a point when the focus shifts from trying to cure an illness to providing comfort and dignity. Ensuring they stay hydrated, keeping their skin clean and moisturized, and reducing physical stress can do more for their overall well-being than prolonged medical interventions that may only add to their suffering. If you notice a loved one experiencing frequent infections, slow healing, or an overall decline in responsiveness, it's important to acknowledge these as signs of the body preparing for its final stage. By shifting the focus to comfort and quality of life, you can help provide the care and support they need during this time. Number 5, major changes in breathing and circulation. One of the clearest signs that the body is preparing for its final stage is a noticeable shift in breathing patterns and circulation. You may observe that your loved one breathes more slowly or shallowly than before. Sometimes their breathing may become irregular, alternating between fast, deep breaths and moments of pause. A specific pattern, known as Cheney-Stokes respiration, involves cycles of rapid breathing followed by periods of little to no breath. These changes may start subtly, but tend to become more apparent over time. Another significant indicator is weakened circulation. Hands, feet, and even the nose or ears may feel unusually cold to the touch. The skin might take on a pale, bluish, or mottled appearance, particularly around the fingers and toes. This occurs because the body, recognizing its limited energy, redirects blood flow to vital organs, reducing circulation to the extremities. Breathing difficulties also become more pronounced. Even minor movements, like sitting up, speaking, or shifting positions, can cause breathlessness. Some individuals begin breathing through their mouth more frequently or struggle to complete sentences without pausing to catch their breath. If they once walked across a room with ease but now find it exhausting, it could be a sign that their lung function is declining. In some cases, fluid accumulation in the lungs can further complicate breathing, causing persistent coughing, gurgling sounds, or a sensation of tightness in the chest. While this may resemble congestion from a cold in elderly individuals nearing the end of life, it often signals the lungs weakening. Many people in this stage find lying flat uncomfortable and may prefer to sleep propped up on pillows or in a recliner to make breathing easier. For families, witnessing these changes can be distressing. The natural instinct is to help, to encourage deeper breaths, or to worry that urgent medical intervention is needed. However, in many cases, these shifts are simply part of the body's gradual slowing down. While they may not be reversible, there are ways to provide comfort. Keeping the room cool, using a humidifier, or offering small sips of water can help ease discomfort. In some cases, medications or oxygen therapy can provide relief, but the primary focus shifts from trying to fix the issue to ensuring the person remains comfortable. If you notice signs such as irregular breathing, cold extremities, or a bluish tint to the skin, it's important to pay attention. These changes are often the body's way of conserving energy and indicate that circulation is slowing down. This is a time to be present, offer reassurance, and create a peaceful environment where they feel safe and cared for. As we conclude, let's reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often emerge in the year leading up to an elderly person's passing. They may not all appear at once, and they may initially be subtle, but recognizing them can provide clarity on what's happening. For families, accepting these changes can be difficult. The instinct is often to fight against them, to encourage a loved one to eat more, stay active, or push through exhaustion. However, the most meaningful thing we can do is honor what their body is communicating. Instead of resisting the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death. It's about being prepared for it. By recognizing these changes early, families can provide better care, make important decisions in advance, and ensure that their loved ones' final months are filled with dignity and love. This is a time for cherishing moments, sharing stories, and reminding them that they are valued and never alone. If you're experiencing this journey with a loved one, take a deep breath and know that you are not alone. Many families have walked this path before, and while it is never easy, awareness and preparation can provide strength, patience, and peace.